I'm Dr. Max Gomez at the Fifth International Vatican Conference, and I am happy to be joined now by someone I am proud to call a colleague, a medical journalist, Dr. Sanjay Gupta. Welcome, Sanjay.
Hey, thanks for having me, Max, and a friend.
Yeah, thank you, thank you. So you, like so many of us, go to a lot of medical conferences, right? And they tend to be narrowly focused on a disease, an organ, or something of that sort. What do you think is the value? You've been to these Vatican conferences before. What do you think is the value of this kind of conference?
Well, I think there's tremendous value because ultimately you want to understand how all these pieces of knowledge that you're taking in, how they are going to come together in some way, and ultimately, be of benefit. I had the privilege of having my wife there as well one year, and she is someone who deals with chronic disease, and it was fascinating. And she's not a doctor, but it was fascinating to see it a little bit from her eyes. She was attending all these sessions and integrating information and putting it together. Ultimately, we all stand in service to our patients and trying to care for people. And a conference like this really gives us an integrative approach of lots of new medical knowledge.
You, like so many of us, have been completely immersed in the pandemic for the past year, all COVID, all the time. What lessons have you learned, you think, about about viral transmission, how people have reacted to all of this? There's been so many aspects of this. What do you think are some of the important lessons that you've picked up from this?
Let me tell you two sort of less intuitive ones quickly. One is that how you establish someone's understanding of risk, I think, is really interesting. You can provide objective data, but the subjective interpretation of that data is something you really have to consider. So if you tell somebody that the pathogen is a 0.5% mortality, a certain group of people will say, 1 in 200 people will die of this. We better take cover. We need to be careful. Another group of people may say, so you're saying I'm 99.5% okay. What's the big deal here? Same data, very different subjective interpretations of the impact of that data. And I think, if you're a communicator, I think you certainly have to always take both into account. You can't just give the objective data. You have to understand how it's going to land. The second thing I would say is that this was a novel virus, Max. We all know that, but that means something. Novel is something that we really haven't experienced before. And I think as adults, when's the last time you truly experienced something for the first time? Doesn't happen very often. So the idea that okay, I'm going to think of this as SARS. I'm going to think of this as H1N1. You want to immediately put it in the box that you have to resist the temptation to do that, whether it's this pandemic or many other things in life.
The whole world is experiencing this for the first time, and that really makes it interesting. Let's
Yeah.
shift gears for a minute and talk about what some people have called a different epidemic, and that's dementia. Your latest book, Keep Sharp, Build a Better Brain at Any Age, which I think is good for me and so many of us. You focus on how to avoid dementia. Can we really ward it off and at any age?
I really do believe we can. I mean, there are societies around the world where dementia is very uncommon. I mean, it gets written up in the medical journal if there's a single case in some of these places. So it's clear that human beings have the capacity to not have this idea that dementia is preordained, that there's this gradual withering away of brain power. I think that's been a narrative, and it's one that I was taught in medical school. You get a certain number of neurons, you drain the cache, and that's it. What we now know, Max, it's fascinating because you and I share this medical journalism in common. I was hearing from neuroscience meetings that you could grow new brain cells at any age, and then emerging evidence on how to do that. I wanted to basically translate that information, that knowledge for the lay public, because it's very exciting in the world of neuroscience. Just hasn't quite reached the lay public yet, and now we're hearing about it. I mean, we're usually focused on the home run therapeutic. But the idea that these lifestyle changes have objective, measurable impact, I think, is really important.
Absolutely. Lifestyle is such an undervalued part of disease and disease prevention that we really all need to take to heart.
Yeah, if you can't measure it, sometimes it tends to be less important. That shouldn't be the case. But now that we have data around some of these things, people are starting to take it much more seriously. How do you objectively describe the benefit of a brisk walk with a close friend? You can't describe it like you would describe a statin,
Right.
but you're getting closer and closer to doing that.
And you can't measure it the same way either.
Right.
Dr. Sanjay Gupta, thank you so much for your time, for being with us. Look forward to seeing you in Rome next time.
An honor, Max. Thank you.